Neurodegenerative diseases are a group of disorders characterized by the progressive degeneration of the structure and function of the nervous system. These conditions primarily affect neurons, the building blocks of the brain and spinal cord, leading to gradual loss of cognitive and motor functions. Common examples include Alzheimer's disease, Parkinson's disease, and amyotrophic lateral sclerosis, ALS. As these diseases progress, they can severely impact memory, movement, and the ability to perform everyday tasks. Understanding neurodegenerative diseases is crucial, as they are becoming increasingly common with an aging population. In this video, we'll explore what causes these diseases, their symptoms, and the latest research on treatments and prevention. Neurons are specialized cells that transmit information throughout the nervous system. They communicate using electrical and chemical signals, allowing us to think, move, and feel. In neurodegenerative diseases, these vital cells become damaged or die, disrupting the flow of information in the brain and body. This disruption can lead to a wide range of symptoms, depending on which neurons are affected. For example, damage to neurons in the hippocampus can cause memory loss, while damage in the motor cortex can affect movement. The loss of neurons is often irreversible, making early detection and intervention essential. Alzheimer's disease is the most common neurodegenerative disorder, primarily affecting older adults. It is characterized by progressive memory loss, confusion, and changes in behavior. The disease is linked to the buildup of abnormal proteins in the brain, such as amyloid plaques and tau tangles, which interfere with neuron function. Over time, these changes cause widespread brain atrophy and severe cognitive decline. Alzheimer's not only impacts the individual but also places a significant emotional and financial burden on families and caregivers. Early symptoms can be subtle, making diagnosis challenging in the initial stages. Parkinson's disease is another well-known neurodegenerative disorder, mainly affecting movement. It results from the loss of dopamine-producing neurons in a region of the brain called the substantia nigra. Dopamine is a neurotransmitter essential for smooth and coordinated muscle movements. As dopamine levels drop, individuals experience tremors, stiffness, slow movement, and balance problems. Parkinson's can also cause non-motor symptoms, such as depression and sleep disturbances. While medications can help manage symptoms, there is currently no cure for the disease, and symptoms tend to worsen over time. ALS, also known as Lou Gehrig's disease, is a progressive neurodegenerative disorder that affects nerve cells in the brain and spinal cord. It primarily targets motor neurons, which control voluntary muscle movements. As these neurons die, muscles weaken and waste away, leading to difficulties in speaking, swallowing, and eventually breathing. ALS progresses rapidly, and most people with the disease have a short life expectancy. Despite extensive research, the exact cause of ALS remains unclear, though genetic and environmental factors are believed to play a role. Huntington's disease is a rare inherited neurodegenerative disorder that causes the progressive breakdown of nerve cells in the brain. Symptoms typically appear in mid-adulthood and include involuntary movements, cognitive decline, and psychiatric problems. The disease is caused by a mutation in the HTT gene, leading to the production of an abnormal protein that damages neurons. Huntington's is unique because it is passed down in families, and genetic testing can identify carriers before symptoms develop. There is currently no cure, but treatments can help manage symptoms and improve quality of life. Multiple sclerosis is a chronic disease that affects the central nervous system, particularly the brain and spinal cord. Unlike other neurodegenerative diseases, MS involves the immune system attacking the protective covering of nerve fibers known as myelin. This leads to communication problems between the brain and the rest of the body. Symptoms can vary widely, including fatigue, difficulty walking, numbness, and vision problems. MS often follows a relapsing remitting course with periods of symptom flare-ups followed by recovery. While treatments can slow progression, there is no cure for MS. Neurodegenerative diseases can present with a wide range of symptoms, depending on the specific disorder and the areas of the nervous system affected. Common symptoms include memory loss, confusion, difficulty speaking, muscle weakness, tremors, and problems with balance and coordination. Some diseases also cause changes in mood, behavior, or personality. These symptoms often worsen over time, making daily activities increasingly challenging. Early recognition of these signs is important for timely diagnosis and intervention, which can help slow disease progression and improve quality of life. Exact causes of neurodegenerative diseases are not fully understood, but a combination of genetic, environmental, and lifestyle factors is believed to contribute. Some diseases, like Huntington, are directly linked to genetic mutations, while others, such as Alzheimer's and Parkinson's, may involve a mix of genetic susceptibility and environmental triggers. Age is the most significant risk factor, as these diseases are more common in older adults. Other risk factors include family history, exposure to toxins, head injuries, and certain medical conditions. Genetics play a significant role in many neurodegenerative diseases. For example, mutations in specific genes can directly cause conditions like Huntington's disease or increase the risk for Alzheimer and Parkinson. Family history is an important consideration, as having a close relative with a neurodegenerative disease can raise your risk. Advances in genetic testing now allow for early identification of at-risk individuals, which can be helpful for planning and early intervention. However, not all cases are inherited, and many involve a complex interplay of genetic and environmental factors. Environmental factors can also contribute to the development of neurodegenerative diseases. Exposure to certain toxins, such as pesticides or heavy metals, have been linked to an increased risk of Parkinson's and other disorders. Head injuries, infections, and chronic stress may also play a role. While it's not always possible to avoid these risks, being aware of them can help individuals make informed choices about their health and environment. Ongoing research continues to explore how these factors interact with genetics to influence disease onset and progression. Aging is the most significant risk factor for neurodegenerative diseases. As we age, our neurons become more vulnerable to damage and less able to repair themselves. This increased susceptibility can lead to the gradual accumulation of cellular damage, which contributes to the onset and progression of diseases like Alzheimer's and Parkinson's. While aging itself cannot be prevented, adopting a healthy lifestyle may help reduce the risk or delay the onset of neurodegenerative condition. Research is ongoing to better understand the biological processes that link aging to neurodegeneration. Common feature of many neurodegenerative diseases is the accumulation of misfolded proteins in the brain. In Alzheimer's, amyloid plaques and tau tangles disrupt neuron function. In Parkinson's, clumps of alpha-synuclein form Lewy bodies which are toxic to neurons. These abnormal proteins interfere with normal cellular processes, leading to cell death and brain damage. Understanding how and why these proteins misfold is a major focus of current research, as it could lead to new treatments that target the root cause of neurodegeneration. Chronic inflammation is increasingly recognized as a key contributor to neurodegenerative diseases. When the brain's immune cells, called microglia, become overactive, they can release chemicals that damage neurons. This ongoing inflammation can accelerate the progression of diseases like Alzheimer's and Parkinson's. Researchers are investigating ways to reduce brain inflammation as a potential strategy for slowing or preventing neurodegeneration. Lifestyle factors such as diet and exercise may also influence inflammation levels in the brain. Oxidative stress occurs when there is an imbalance between free radicals and antioxidants in the body. Free radicals are unstable molecules that can damage cells, including neurons. In neurodegenerative diseases, oxidative stress is thought to contribute to the death of brain cells. Antioxidants, found in many fruits and vegetables, help neutralize free radicals and protect against cellular damage. Research is ongoing to determine whether antioxidant therapies can slow the progression of neurodegenerative diseases. Mitochondria are the energy-producing structures within cells. In neurodegenerative diseases, mitochondrial dysfunction can lead to reduced energy production and increased cell death. This is particularly problematic for neurons, which require large amounts of energy to function properly. Mitochondrial problems have been implicated in diseases like Parkinson's and ALS. Scientists are exploring ways to support mitochondrial health as a potential avenue for treatment and prevention. Recognizing the early warning signs of neurodegenerative diseases is crucial for timely intervention. These signs may include subtle memory lapses, difficulty finding words, changes in mood or personality, and problems with coordination. In some cases, family members may notice these changes before the individual does. Early diagnosis allows for better management of symptoms and planning for the future. If you or someone you know is experiencing these symptoms, it's important to seek medical advice promptly. Diagnosing neurodegenerative diseases can be challenging, as symptoms often overlap with other conditions. Doctors use a combination of medical history, physical exams, neurological tests, and brain imaging to make a diagnosis. In some cases, genetic testing or analysis of cerebrospinal fluid may be used to confirm a specific disease. Early and accurate diagnosis is essential for developing an effective treatment plan and accessing support services. Brain imaging techniques, such as MRI and PET scans, play a vital role in diagnosing and monitoring neurodegenerative diseases. These tools allow doctors to visualize changes in brain structure and function, such as atrophy or abnormal protein deposits. Imaging can help differentiate between different types of neurodegenerative diseases and track disease progression over time. Advances in imaging technology are improving our ability to detect these diseases earlier and more accurately. Biomarkers are measurable indicators of disease that can be detected in blood, cerebrospinal fluid, or through imaging. In neurodegenerative diseases, biomarkers such as abnormal protein levels or genetic mutations can aid in early diagnosis and monitoring. Researchers are working to identify new biomarkers that can help distinguish between different diseases and predict how quickly they will progress. The development of reliable biomarkers is a key goal in the fight against neurodegeneration. While there is no cure for most neurodegenerative diseases, various treatments can help manage symptoms and improve quality of life. Medications may be used to address specific symptoms, such as memory loss, tremors, or mood changes. Physical, occupational, and speech therapies can help maintain independence and function. Support from healthcare professionals, caregivers, and support groups is also essential for managing the challenges of these diseases. Medications for neurodegenerative diseases are designed to manage symptoms, and in some cases slow disease progression. For example, cholinesterase inhibitors are used in Alzheimer's to boost memory, while levodopa helps manage movement symptoms in Parkinson's. Other drugs may address mood, sleep, or behavioral issues. It's important to note that these medications do not cure the underlying disease, but they can significantly improve daily functioning and quality of life. Physical and occupational therapies are important components of care for people with neurodegenerative diseases. Physical therapy focuses on maintaining mobility, strength, and balance, while occupational therapy helps individuals adapt to daily tasks and maintain independence. These therapies can be tailored to each person's needs and abilities, helping to slow functional decline and improve overall well-being. Regular therapy sessions can also provide emotional support and motivation. Speech and swallowing difficulties are common in many neurodegenerative diseases, especially ALS and Parkinson's. Speech therapy can help individuals communicate more effectively, while swallowing therapy focuses on safe eating and drinking. These therapies use exercises and strategies to strengthen muscles and improve coordination. Early intervention can prevent complications such as choking or malnutrition, making these therapies an essential part of comprehensive care. Adopting a healthy lifestyle can help manage symptoms and may slow the progression of neurodegenerative diseases. Regular physical activity, a balanced diet, adequate sleep, and stress management are all important. Social engagement and mental stimulation such as puzzles or learning new skills can also support brain health. While lifestyle changes cannot cure these diseases, they can improve overall well-being and quality of life. Living with a neurodegenerative disease can be challenging, both for individuals and their families. Support systems, including family, friends, caregivers, and support groups, play a vital role in providing emotional and practical assistance. Access to counseling, respite care, and community resources can help reduce stress and improve coping. Building a strong support network is essential for maintaining quality of life and managing the demands of these diseases. Caregivers of people with neurodegenerative diseases often face significant physical, emotional, and financial challenges. Providing care can be demanding and may lead to stress, burnout, or health problems for the caregiver. It's important for caregivers to seek support, take breaks, and prioritize their own well-being. Resources such as respite care, counseling, and caregiver support groups can help manage the demands of caregiving and prevent burnout. Research into neurodegenerative diseases is advancing rapidly, with scientists working to better understand the underlying causes and develop new treatments. Recent breakthroughs include the discovery of new genetic risk factors, improved imaging techniques, and experimental drugs that target abnormal proteins. Clinical trials are ongoing to test promising therapies, and advances in technology are accelerating progress. Continued research offers hope for more effective treatments and eventually cures. Stem cell therapy is an exciting area of research in neurodegenerative diseases. Stem cells have the potential to develop into many different types of cells, including neurons. Scientists are exploring whether stem cell transplants can replace lost or damaged neurons and restore function. While this approach is still experimental, early results are promising, and ongoing clinical trials are testing its safety and effectiveness. Gene therapy aims to treat or prevent neurodegenerative diseases by correcting or replacing faulty genes. This approach is particularly relevant for inherited disorders like Huntington's disease. Researchers are developing techniques to deliver healthy genes to affected brain cells, potentially halting or reversing disease progression. While gene therapy is still in the early stages, it holds great promise for the future of neurodegenerative disease treatment. Immunotherapy is a treatment strategy that harnesses the body's immune system to fight disease. In neurodegenerative diseases, immunotherapies are being developed to target and remove abnormal proteins from the brain. For example, monoclonal antibodies are being tested to clear amyloid plaques in Alzheimer's disease. While these treatments are still experimental, they represent a new frontier in the fight against neurodegeneration. While not all neurodegenerative diseases can be prevented, adopting a healthy lifestyle may reduce risk or delay onset. Regular exercise, a Mediterranean-style diet, mental stimulation, and social engagement have all been linked to better brain health. Avoiding smoking, excessive alcohol, and managing chronic conditions like diabetes and hypertension can also help. Prevention strategies are an important part of public health efforts to reduce the burden of these diseases. Diet plays a significant role in brain health. Diets rich in fruits, vegetables, whole grains, lean proteins, and healthy fats have been associated with a lower risk of neurodegenerative diseases. The Mediterranean diet, in particular, has shown promise in supporting cognitive function and reducing inflammation. Limiting processed foods, sugar, and saturated fats is also recommended. Nutrition is a modifiable risk factor that can have a positive impact on brain health. Regular physical activity is one of the best ways to support brain health and reduce the risk of neurodegenerative diseases. Exercise increases blood flow to the brain, promotes the growth of new neurons, and reduces inflammation. Activities such as walking, swimming, and strength training are all beneficial. Even moderate exercise can make a difference, and it's never too late to start. Staying active also supports overall physical and mental well-being. Keeping the brain active through mental stimulation is important for maintaining cognitive function. Activities such as reading, puzzles, learning new skills, and engaging in social interactions can help build cognitive reserve. This reserve may delay the onset of symptoms in neurodegenerative diseases. Lifelong learning and curiosity are key to keeping the mind sharp and resilient. Quality sleep is essential for brain health. During sleep, the brain clears out waste products and consolidates memories. Poor sleep has been linked to an increased risk of neurodegenerative diseases, particularly Alzheimer's. Establishing good sleep habits, such as maintaining a regular schedule and creating a restful environment, can support cognitive function and overall well-being. Managing chronic health conditions such as diabetes, high blood pressure, and high cholesterol is important for reducing the risk of neurodegenerative diseases. These conditions can damage blood vessels and reduce blood flow to the brain, increasing vulnerability to cognitive decline. Regular checkups, medication adherence, and healthy lifestyle choices are key strategies for protecting brain health. Social connections are vital for mental and emotional well-being. Staying connected with family, friends, and community can help reduce stress, combat loneliness, and support cognitive function. Social engagement has been linked to a lower risk of neurodegenerative diseases and slower progression of symptoms. Participating in group activities, volunteering, or joining clubs are great ways to stay socially active. The future of neurodegenerative disease research is filled with promise. Scientists are exploring new approaches, such as personalized medicine, advanced imaging, and artificial intelligence, to improve diagnosis and treatment. Collaboration between researchers, clinicians, and patients is accelerating progress. As our understanding of these diseases grows, so does the hope for more effective therapies and ultimately prevention or cures. Living with a neurodegenerative disease presents many challenges, but it's possible to maintain a good quality of life with the right support and strategies. Focusing on abilities rather than limitations, staying engaged in meaningful activities, and seeking help when needed can make a significant difference. Advances in care and support services are helping people live longer, more fulfilling lives despite these conditions. Hearing from individuals living with neurodegenerative diseases can provide valuable insight and inspiration. Patient stories highlight the resilience, adaptability, and courage required to face these challenges. Sharing experiences helps build community and raises awareness about the realities of living with neurodegeneration. These stories remind us of the importance of empathy, support, and continued research. Advocacy and public awareness are essential for improving the lives of people with neurodegenerative diseases. Raising awareness helps reduce stigma, increases funding for research, and promotes access to care and support services. Advocacy organizations play a key role in educating the public, supporting patients and families, and driving policy changes. Everyone can contribute by learning more and spreading the word. Neurodegenerative diseases are a growing global health concern, affecting millions of people worldwide. The increasing prevalence of these diseases places a significant burden on healthcare systems, families, and economies. International collaboration is essential for advancing research, improving care, and developing effective prevention strategies. Addressing the global impact of neurodegeneration requires coordinated efforts from governments, researchers, and community. Despite the challenges posed by neurodegenerative diseases, there is hope for the future. Advances in research, improved treatments, and greater awareness are making a difference. Early detection, personalized care, and innovative therapies offer new possibilities for patients and families. By working together, we can continue to make progress and move closer to a world without neurodegenerative diseases. Neurodegenerative diseases are complex and challenging, but understanding them is the first step toward better care and prevention. We've explored the causes, symptoms, diagnosis, and treatment options, as well as the importance of support and research. While there is still much to learn, advances in science and medicine are bringing hope to millions. By staying informed and supporting ongoing research, we can all contribute to the fight against neurodegenerative diseases.